Now, to touch on some of the practical perspectives that are driving digital health on the continent, please welcome Dr. Nondumiso Makhunga-Stevenson, the founder of Ubuntu Doctor Coaching. Dr. Makhunga-Stevenson is a physician, leadership development, and executive coach with over 20 years of experience in Africa's health sector. Our expertise spans clinical medicine, public health, and medical affairs across corporate, non-profit, and government sectors, enabling her to blend clinical insight with leadership development. With a Bachelor of Medicine and Bachelor of Surgery and an MSc in Clinical Epidemiology, Dr. Makhunga-Stevenson empowers physicians to enhance their leadership skills, align with their purpose, and drive sustainable impact. Our Ubuntu-centric coaching fosters compassion, collaborative, and resilient leadership, fostering excellence and empathy within teams and organizations. Please welcome Dr. Makhunga-Stevenson, who will present strategies for empowering a new generation of physician leaders in digital health. Welcome.
Thank you, and thank you for the warm welcome.
So please, you can start your presentation now.
Okay, thank you.
Thank you.
All right, and thanks again for the invitation to speak on such an important topic. So essentially what I will be doing in my presentation is speaking to how to empower physicians as leaders, but really trying to drive the points about ethical and effective digital health transformation and the role that leaders can play in that. I'll also be talking through the importance of physician leadership in this evolving digital health space. Next slide, please. So as indicated, my name is Dr. Nondumiso Makhunga-Stevenson, and I am the founder of Ubuntu Doctor Coaching, and I help doctors to become high-impact Ubuntu-centric leaders. Next slide, please. In terms of the outline of my presentation, I'm going to firstly set the scene with regards to the context in which physician leadership is going to be required in digital health. As you know, doctors, we often lead in clinical excellence, but there are broader contexts that need to be considered. And so I'm going to explore essentially how to bridge that gap. As the second part of my presentation is also going to look at why physician leadership in digital health matters now more than ever before, considering the new technology shifts and the policies as well that come with the changes in the landscape. I'll also speak to a real-world example of the challenges or potential challenges that can face physician leaders as the digital health takes off and becomes part of our normal day-to-day work. And in that particular case study, I'll be zoning in on AI. And then I'll finally distill the key lessons from the case study and hopefully into some actionable recommendations and insights that doctors will be able to apply in their own leadership journey. But also for those that are working, that are not necessarily physicians or in the clinical space, how those digital health innovations could work and how they could also work with physicians. Next slide, please. Right, so why does physician leadership in digital health matter? The reality is that we are transitioning very fast from outdated infrastructure, and the role of full-scale digital health is taking off. And so that transformation, as doctors, we cannot be left behind without fully understanding those issues. I want to also just zone in on Africa because this is my personal view. There's going to be a healthcare revolution powered by digital innovation. And part of that is because of the need of the healthcare systems in Africa, which have been distressed for some time. So the potential for digital health tools, whether it's AI diagnostics, whether it's telemedicine, have immense potential in Africa. And at the same time, we have this dual role as physicians, where we are both navigating patient care while we are having to also adapt to technology as well as the regulatory demands. So what this essentially means is that doctors or physicians are in a good position. They're well positioned to ensure that digital health advancements are not only innovative, but they're also safe, and that they are ethical, and they're also compliant. So in summary, there's a need for strong physician leadership, and that's very clear. And one area where the leadership of physicians is going to be critically tested is in the adoption of digital health. Although we know that this is an area that it has a lot of potential, it's also an area that has potentially many barriers that leaders must navigate. Next slide, please. So when it comes to barriers to adoption, and I'm going to hone down on this because this also leads into the case study, adopting to digital health is not necessarily going to be an easy journey, and we have to navigate some of these complexities. And one of those areas that has to be considered is the regulatory landscape for digital health, which is not just complex, it's also highly fragmented. It's constantly evolving. You have different countries, different regions, and all of these have unique standards, and they have unique requirements for data privacy, interoperability, and also for compliance. Another critical challenge is the lack of clinician involvement in key decisions related to digital health, particularly at the conceptualization phase. And so these decisions are often made by administrators or IT teams when it comes to implementation, without sufficient input from the people who are actually going to be using the technology. And those are the clinicians and the physician leaders who will have some additional insights. And so sometimes the solutions may not integrate seamlessly into the clinical workflows, and that can increase frustration and lead to resistance to adoption of these solutions. So, for example, if you have an overly complex electronic health record system, that can actually create more of an administrative burden for doctors than reducing it. So as physician leaders, the understanding of these barriers becomes quite essential, because it allows us to advocate for policies, and it allows us to advocate for processes that not only address these challenges, but also ensure that digital health tools are designed with the clinicians' needs in mind, but importantly, to improve patient outcomes. Next slide, please. Okay, the next slide. You can please move to slide 8. Excuse me, slide 7. So the case study that I'll be presenting was published last year in 2023 in the Implementation Science Communications. It's called Innovation in Healthcare Leadership, Perceptions About Innovation, Characteristics of Artificial Intelligence, and it was a qualitative study with healthcare leaders in Sweden. Now, you may ask me why in Sweden. This is another gap, and maybe for another conference, on how do we document and create a scientific evidence in at this stage, particularly at this stage, with regards to that. So, as Africans, we need to perhaps consider how we actually write up all our findings and invest more in research and publications as well. We can go to the next slide. So in this slide, I'm just going to summarize the methodology of the study. As I indicated, it was a qualitative research study that was guided by the Consolidated Framework for Implementation Research, and it focused on a number of constructs, and that included the innovation source, the evidence-based, relative advantage, adaptability, trialability, complexity design, and the cost. And the respondents in the trial were 26 healthcare leaders. And these were healthcare leaders that it was not disaggregated by the role, but it also included physician leaders in the healthcare system, as well as formal managers who were implementation leaders, representing a diversity of leadership roles that were clinical roles as well as administrative functions. It was done through semi-structured interviews. And the key insights that were being captured was around the questions and the views of the leaders on AI, including the perceptions of AI's opportunities, barriers, and implementation challenges. And it was also intended to identify any socio-technical challenges and opportunities for AI implementation, but also to understand the leadership's role in driving digital health transformation. So this methodology ensured that there was a comprehensive understanding of both the technical as well as the organizational dynamics that were influencing the adoption of AI in this particular healthcare system. We can move to the next slide, please. So the insights on the selected findings, or the findings really in summary, was that the healthcare leaders expressed high expectations of the relative advantage of AI. They recognized its potential to improve diagnostics, to improve resource allocation, and also the potential to support decision-making. But there was some skepticism about evidence base. There were concerns about safety and effectiveness, reliability, and they were also tentative about trialability, meaning that the leaders felt that there was limited trialing of AI, and so they were uncertain about the actual outcomes of those trials. There was also uncertainty about the flexibility of AI and whether it would be able to integrate into diverse healthcare settings. And this for us becomes very important in terms of ensuring that we create our own AI for our own healthcare settings in Africa, as opposed to importing digital health tools that are perhaps designed elsewhere with minimal understanding of the context. The other concern that they noted was that, the poorly designed systems could possibly hinder adoption because they were not user-centered, and they would therefore not align with the clinical workflows. And of course, cost is always a consideration. There was, not enough information with regards to the initial investment and ongoing operational expenses for implementing AI. And also, it was not clear what the trade-offs will be between these costs and the expected benefits. What are the long-term costs? And how this could be, what in terms of the updates that would be needed, certain questions like that. So there was all this uncertainty due to the early stage deployment. So another issue was really around the ambiguity of AI. How do you even define AI? What is the vocabulary that physician leaders can use to communicate about AI, and so how it will be implemented? And so the perceptions were very diverse and ambivalent. There was, of course, the fear of losing autonomy and being displaced as clinicians by digital health tools, including AI. And so there was also a skepticism and a lack of trust around that. And then also noted that the collaboration between physicians and data scientists was also essential in order to ensure that the tools are technically robust, but also practically meaningful in clinical settings. And so I'm going to just pause on this slide, the next one, which is the implications for physician leaders from the study, and essentially highlight some of the key takeaways from the study. Firstly, effective leadership is going to be critical in navigating the complexities of digital health adoption. However, that leadership must also be able to guide diverse stakeholders. So that includes clinicians, data scientists, and policymakers. The ethical and the legal challenges will definitely need to be addressed, such as the data security. And it's also going to be important to bridge the black box problem. So this lack of transparency in terms of the AI's decision-making processes in this case. So that creates some uncertainty for healthcare professionals. So leaders are going to have to bridge this gap through education and also understanding AI's mechanisms, the limitations of AI, as well as the benefits, so that clinicians can start to be comfortable to use this technology. And of course, I mentioned the issues of the cost. So in essence, there has to be additional transparency in all of these aspects that will help to build organizational confidence in AI adoption. So this was the outcome from the study. So I'm going to ask to move to the next slide where I'll quickly go through the way forward. If you can move to slide 12, please. So what is the way forward? And this is just a synopsis again of understanding the case study. For me, the way forward is really developing a pipeline of skilled physician leaders who are AI ready, but also digital health ready in general. Given that we are at the crossroads of a profound transformation in healthcare, and one that arguably is going to be driven by rapid advancements in digital health and AI, these tools are going to become increasingly integrated into clinical environments. So although they hold the promise of transforming and revolutionizing patient care and improving efficiency and enhancing diagnosis, we still need to address some of these critical challenges. And there are opportunities, for example, in the workforce shortages. So these leaders need to not only be tech savvy, but they also need to be equipped with strategic, with ethical and collaborative skills in order to be able to be at the forefront of this, be able to communicate the benefits of AI, be able to critically evaluate AI as to whether it is relevant for their particular context or not, and also be able to tailor AI to local challenges. So the collaboration is going to be key. The understanding of AI ethics and compliance is going to be important, and finally, building peer networks across regions as well as international networks for knowledge exchange and best practices sharing is also going to allow us to learn from diverse perspectives and experiences globally. Next slide, please. So as I summarize, the important where we are today in terms of AI is that as physicians, and particularly those that are in leadership positions, we're going to have to accept that digital health and AI is going to continue to gain traction in healthcare because of its potential. So it is really for us to fully realize these benefits and overcome some of these significant challenges. There has to be targeted training, addressing the legal, ethical, and technical barriers, engaging physicians in AI development and implementation at the conceptualization stage, not at the point where you want to test the user experience, and also fostering leadership. So having leaders that are able to understand AI much deeper, build the cross-collaboration, cross-industry collaborations, and also promote evidence-based AI implementation. So in this slide, this is the reference if you are interested. But I want to, if you don't mind, to move to the next slide, which is the call to action. I just want to leave with this parting shot that the time really is now. We know that the world is moving very fast, and it is important for physicians and particularly physician leaders to position themselves to be able to guide this adoption, because clinical expertise and understanding of patient care remains your responsibility, but it also makes you a critical steward of these technologies. And so in doing that, for physician leaders that are in a position to do so, they need to advocate for targeted investments and funding, including funding for leadership development programs that will teach these skills, but also funding to develop additional technologies to support patient care. And then finally, of course, to encourage that collaboration, because we know that leadership is not a solo effort. It requires that as doctors, we also build bridges across disciplines, industries, and borders. Thank you so much. I will close there for today.
That was a great presentation. So just one question for you before we leave this session. What key skills and competences do you believe are essential for physicians to lead effectively in this evolving digital health landscape, and how can they be developed?
Yeah. Well, I think it's going to be a combination of some hard skills. So meaning just to understand what digital health is, what does it do? Research skills are going to be quite critical in order to be able to build the evidence base. Understanding, how to communicate. These are the soft skills as well. How to communicate the value of the digital health to patients as well, but also to bodies that will promote adoption. But it is an opportunity. I think your question is a very good question, but what it does actually call for is as I mentioned, we need to perhaps take a pause and do the work and really try and bridge that gap between digital health innovators as well as the clinicians, so that we can see the specific skills that will be of value in ensuring that they are equipped with the skills to be able to drive this innovation from the clinical side.
So we have one more question. The question is, are we seeing any novel jobs or roles emerging in Africa yet, which combines clinical training with capabilities to leverage AI or digital innovations?
In my search for a case study, as I mentioned earlier, I struggled a little bit to find data from Africa. And I think that really, to some extent, answers the question. I saw some studies that were doing exactly that. So basically, incorporating training from medical student level into a residency, as well as for people that had already specialized. But I struggled to find that in Africa. Notwithstanding, I think it's a very important question in the sense that, this is an opportunity for us to really start thinking about repurposing for those of us that are already qualified. How do we repurpose our career? How can we add on to our career and become a chief information or technology or digital health expert, just an advocate, but an expert? And so what are the types of maybe courses or trainings that we would need to do in order to empower doctors to be able to lead also in that space? So to answer the question, I haven't come across it. I'm not aware of it. Perhaps there are some in Africa, but I'm looking at it as a huge opportunity and potential, especially where you have unemployed doctors. Could we assist them and help them to maybe qualify to be drivers in digital health? That's the way I'm seeing it. But it's a great question. Thank you.
Thank you for your response. And thank you so much for this presentation today. Developing leadership in digital healthcare is important to drive meaningful change in the digital health space. And as Dr. Makhunga-Stevenson said, it's important to develop targeted training programs for healthcare leaders and help them truly understand how they can use AI. And she highlighted something very important. It should be at the point of conception, not at the point you need them to then implement those changes. So thank you so much for sharing your insights with us today. We're truly grateful to have had you join us. It was a very inspiring session. Thank you.
Thank you so much. Thanks for having me.
So to all of our participants, thank you. It's been such an insightful experience so far. It's been incredible. We've had some really thought-provoking sessions. We're learning so much, right? We're getting inspired to continue to support digital health outcomes in Africa. So please continue to engage in the chat, continue dropping your sessions in the Q&A box. We still have so much more for you today, from panel sessions to more case studies and product demos. So let's continue to explore the conference site, look through the agenda, look at the speaker bios, and you can also bookmark your favorite sessions. And also remember, all participants will get a certificate of attendance at the end of the conference. Thank you.
Thank you.
Once again, Dr. Stevenson. So now we're going to move on to our first panel session of the day, which would be on our first panel session of the day would be on expanding health insurance coverage in Africa, the role of digital innovation. But before we get into that session, we're going to run some polls to get your insights and your perspectives so far. So I'm going to run the polls now. Please feel free to engage, participate. Let's get your perspectives as well on the digital health innovation progress in Africa. Thank you. So I've launched the poll now. They should be visible on your screen. The first question is, how can digital health platforms address disparities in access to healthcare in Africa? Should we focus on mobile-first solutions? Should we partner with local healthcare providers? Should we subsidize costs for underserved populations or provide offline functionalities? So that's a question trying to get your insights on what the best way is to address these disparities we have currently in access to healthcare in Africa. So another question is, what is the best way to ensure the sustainability of digital health initiatives in Africa? Is it through public sector investment, private sector funding and innovation, international aid and partnerships, or community-driven ownership models? So we have people already who are responding to the polls. Thank you for engaging. It's an opportunity to share your perspectives as well. And we would launch the results to the polls on our social media platforms after, to also show what the participants of this conference today, who are coming from different parts of Africa and beyond, to get to show their perspectives on digital health, innovation, and development in Africa. So for the third question, what is the most significant public perception challenge for digital health in Africa? Is it the fear of job losses in traditional healthcare roles? Is that why people don't want to go for digital health? Is it the distrust in technology? Is it concerns about data security, or a resistance to change in the healthcare practices they're used to? And the fourth question is, what is the biggest challenge in implementing AI in African healthcare? Is it the lack of local expertise, the high cost of development, insufficient data for AI training, or ethical and regulatory concerns? So please continue to answer the polls. There are about 8 questions. So we would love to get your insights as well. The fourth question is, what is the biggest challenge in implementing AI? Okay, we already covered that. The fifth question is, what is the best way to measure the impact of digital health initiatives in Africa? Is it by the improved health outcomes for targeted disease, increased accessibility of healthcare services, reduction in healthcare delivery costs, or user satisfaction and adoption rates? So please put your thoughts and choose the option that most resonates with you in the poll. So how important is addressing healthcare inequalities in digital health strategies for Africa? So please rate what you think is the level of importance for us to address these health inequalities in digital health strategies in Africa. Seventh question is, what should be the priority for digital health policymakers in Africa? Should they focus on harmonizing regulation across borders? Should they focus on ensuring equitable access to technology? Should they strengthen data protection laws or facilitate public-private partnerships? And the final question of our poll today is, what is the biggest risk of rapid digital health adoption in Africa? Is it widening the digital divide? Is it a breach of patient confidentiality and over-reliance on technology without proper infrastructure? Or is it the regulatory gaps? So we'll just give a few minutes for you to continue to put your thoughts in the polls, and then we would talk through some of the results. And in just about 10 minutes, we would then move into our next session of the day. Thank you. So please continue to engage in the polls, continue to also engage in the chats, get to know each other, network, share your LinkedIn information, connect, and make the most of all of the opportunities we have for you today. While you're answering the polls, I'm just going to reiterate some of the key points that we need to pay attention to go to the agenda at the top menu, click on the live sessions, and you'll be able to join the session that is live at the moment. And remember, you can also bookmark your favorite sessions so you don't miss them. So go to the conference site and continue to engage, continue to familiarize yourself with the site. And if you have any technical difficulties, our support team can assist you. Thank you once again to all of our panelists, our speakers, our partners, and our sponsors for today's conference. It's been an incredible experience. So we're getting more responses in the polls. Thank you for participating. In about 2 minutes, I'm just going to go through some of the results to also just show you what the thoughts of the participants are, and then we would jump right into our next session for the day, which is our panel session. Keep putting your thoughts in the polls. We're getting more responses and interesting diversity in the answers that are being given in the polls. The polls are still displayed on your screen at the moment, so continue to respond so we can also get your insights and your perspectives on digital health advancements in Africa. And remember, the results of this would be displayed on all of our social media platforms later on to share the insights from the participants of this conference. will come from Africa and beyond on the digital health innovation and advancements in Africa. So I'll just highlight some of the interesting results we've gotten so far. So for the first question, how can digital health platforms address disparities in access to healthcare? The majority of people said the solution to that is to partner with local healthcare providers, which is very interesting because that is the best way for you to spread across as many locations as possible, because there are local health providers who already provide the solutions. So if you implement your digital health innovations with their services, you get to cover as much people as possible. And some other people say it's to subsidize costs for underserved populations, which is very important. Affordability is a big problem in healthcare access in Africa. So for the question, what is the best way to ensure the sustainability of digital health initiatives in Africa? Majority of people say it's about having community-driven ownership models, which is having the community lead and drive their own digital health initiatives, which is important because it allows the communities to implement it in a way that benefits and works with their local customs and traditions the best. For the third question, we had four options. The third question, what is the most significant public perception challenge for digital healthcare in Africa? The options were the fear of job losses in traditional healthcare roles, the distrust in technology's accuracy, concerns about data security, and resistance to change in healthcare practices. And majority of people chose resistance to change in healthcare practices, which I think is, a pretty accurate reflection of some of the challenges that we're facing. A lot of people are used to the status quo and don't want those changes to, not like they don't want changes to occur, but they don't actively support digital health innovation because they're used to the way in which they conduct their practices. Just a reminder, we're going to be joining our next session in the next 9 minutes by 11:50. The joining instructions would be displayed on the screen once it's time to join. But just to go through a few more of our poll results, I hope you enjoyed engaging in this poll session. The insights we are getting from it is going to be very helpful in understanding what a broad number of participants feel about healthcare innovation in Africa. So another question is, what is the best way to measure the impact of digital health initiatives in Africa? And the most chosen answer to that is increased accessibility of healthcare services. And the other options were improved health outcomes for targeted diseases, reduction in healthcare delivery costs, and user satisfaction and adoption rates. So the best way to measure the impact of digital health initiatives in Africa, according to this audience, is when we have increased accessibility to healthcare services across all the different locations, including the rural areas as well. So how important is addressing health inequalities in digital health strategies for Africa? So of course, everyone says it's extremely important. Well, some people say it's very important. But ultimately, we cannot advance healthcare if we don't focus on achieving an equitable healthcare access for everyone, whether they can afford the most expensive healthcare options or not. And the seventh question is, what should be the priority for digital health policymakers in Africa? Should they harmonize regulation across borders? Should they ensure equitable access to technology? Should they strengthen data protection laws or facilitate public-private partnerships? For this one, there's a tie between harmonizing regulations across borders and ensuring equitable access to technology. And I understand why this is the priority for the people who answered in the poll, for our audience today. It's important for us to be able to have consistent regulation across healthcare in Africa and also ensure that there's equitable access to technology. And for the final question we had in our poll today, what is the biggest risk of rapid digital health adoption in Africa? There is a tie as well between the breaches of patient confidentiality and regulatory gaps. The other option are widening digital divide or over-reliance on technology without proper infrastructure. So in the biggest risk of rapid digital health adoption in Africa, so in choosing breaches of patient confidentiality, it shows that if we don't have proper data protection and privacy laws, we run the risk of creating more dangers with rapid digital health adoption. And there are also significant gaps in regulation. So thank you everyone for participating in our poll. I hope you enjoyed it. And hopefully we would share your insights on our social platforms after the conference. Thank you. And please continue engaging in the chat. Some people have dropped their LinkedIn, they're introducing themselves, continue to connect with each other. It's an opportunity to meet different people who are like-minded and passionate about digital health advancement in Africa. So now it's time to join our next session So it's time to join our first panel session of the day, titled Panel Session 1, Expanding Health Insurance Coverage in Africa, the Role of Digital Innovation. This is a great opportunity to learn about how digital innovation is driving health insurance in Africa. And as we saw from our poll results just now, a lot of people believe that digital health insurance advancement is one of the key ways to advance health accessibility in Africa. So to join this panel session, please leave this session that we are at the moment, go back to the conference site. On the conference site, you go to the agenda at the top menu of the site and then click on the live tab to see the session that's currently active. Then finally, click on the join button on the right of the next session's topic and you're in. Thank you. A banner would be displayed shortly to guide you on how to join the next session. So thank you, everyone. Thank you again for participating in the polls and see you in the next session.